I'm Anthony Redmond. I'm Professor of Clinical Biomechanics at the University of Leeds and Chapel Allerton Hospital, and I'm a podiatrist by background, and I have been talking about foot problems in rheumatology and the unmet needs of foot problems in rheumatology. In particular, the fact that almost all patients in some of our patient populations have foot involvement, and the fact that despite the high level of foot involvement, we don't routinely assess the foot. We very rarely even ask questions about the feet, and we have very patchy pathways into treatments for them. In diseases such as rheumatoid arthritis, up to 90% of people can have foot involvement, but despite the high level, we don't usually take the time to assess the feet properly. Most importantly, we don't even ask the question, do they have foot problems today? Foot problems are very important to patients, and we know this. We have both anecdotal evidence, and we get very high turnouts for patient and public involvement events that are around the foot and ankle. And in a recent survey we did with NRAS, 594 people responded to their access to foot services. 94% of them reported having current foot problems, but fewer than half had been able to access NHS services to help with those problems. A third were paying for private services, and we know that for things like referral pathways, the uptake in rheumatology departments is less than 10%. So fewer than 1 in 10 rheumatology departments have a plan for what to do with this high number of patients who have foot problems. So what we're calling for today, and in the presentations we've been doing, is for rheumatology as a community to take foot problems a little bit more seriously, to always ask the question, ask at every appointment, do you have problems with your feet today? It doesn't take expertise to ask the question, and you don't necessarily have to follow it up on the day, but it opens the dialogue with the patients, and that's something we need to do, is start the conversation.